In the past 15 years, HIV rates in Kenya have nearly been cut in half. But one group of Kenyans has been left behind: children. In an effort to fill these gaps, IMA is leading efforts under the AIDSFree project in Kenya. IMA is working with local partner CHOC to strengthen community engagement on children and HIV issues.
Children specifically, they face stigma from peers at schools. They face stigma from peers in the community. This is coming from the adults or their parents or caregivers that are taking care of them. They discourage them from interacting and playing with children in the communities that are infected by HIV and AIDS.
The AIDSFree approach taps into the strengths of existing community resources and mobilizes them to work together as a network of pediatric HIV champions. More than 100 pediatric HIV champions, including community health workers, were trained on techniques for recognizing potential risks of pediatric HIV and how to work with the community to get the children and parents tested.
A community health worker is, we say, the doctor of the community from down there. Every week I go around the houses. I talk to them about health issues. I refer them. I used just to talk about HIV on adults. We have a need to take care of our children too and talk to them about HIV and AIDS.
After the training, the first Friday, after the prayers, we had a meeting with the youth. I explained to them the benefits of getting tested, knowing your HIV status. So they give in, they go tested. 17 youth right now have been tested. I was impacted, I was an ambassador. Now I have like 17 ambassadors out there for me.
But what makes this program innovative is pairing those community health workers with new, unique, and powerful partners.
One of the unique things that IMA is doing is that we are working with religious leaders. By using religious leaders, we are sure that we are reaching people who would probably not be reached by any other mode.
For most Kenyans suffering from HIV, religious institutions have not been a sanctuary.
People in the church think that people who get HIV are sinners. So they don't think even if we can have people in the church who are HIV positive.
Religious leaders can be powerful allies for those suffering from HIV and powerful communicators on the realities of the disease. AIDSFree has also trained religious leaders on how to talk to congregants about pediatric HIV and how to refer potential patients to health facilities. In addition, IMA developed sermon and kupta guides on children and HIV and trained religious leaders on their use in order to equip religious leaders with the adequate tools, skills, and knowledge to effectively communicate and influence their congregants on pediatric HIV.
From the Old Testament, some diseases were associated with sin. And Jesus told them it has nothing to do with sin. You know, we can equate HIV maybe with a contagious disease like leprosy during those days. It's a disease, so treat it as a disease. Don't bring other issues.
So the Bible also tells us about the diseases. Now I'm telling them, even those who are HIV positive, even if they are in the church, we need to love them, care for them, because they are our brothers and sisters.
This kind of outreach has shown promising results so far. From the data collected between August and October of 2016, AIDSFree observed an increase in referrals from all sources. Specifically, religious leaders referred over 150 community members for pediatric HIV services and provided psychosocial support, including adherence and spiritual counseling, to 111 children.
In before people saying HIV as disease of levy, those people who use drugs, sex worker. But after the training, I came to realize that HIV is between us, me and you. When we talk about HIV and AIDS, they just talk to it like eating. Not that big deal. It's just a small deal, and somebody can be free even if it's HIV positive.
Since the training, I've seen a big change on the community because I reach the people that I could not reach. People really love the program. If I work on the community, people tell me, can you test us? It have totally changed my life, and I love the job.